Let me ask you something. You might be trying to eat healthy and you might be trying to reduce sugar and carbs in your diet. You are walking 10,000 steps every single day, but your weight is getting stuck. Or maybe your blood reports are showing prediabetes or high blood sugar, and slowly you started thinking, maybe my metabolism is slow, maybe it's because of my age, or maybe my body just cannot lose the weight. But what if I tell you, your problems may not be just calories, your problem may be the insulin resistance. And insulin resistance is actually the starting point of type 2 diabetes. So in this video, I'm going to explain you how exactly it happens. So before we start, let's understand what is insulin. So whenever you eat any kind of food, especially the food which have carbohydrates like rice, dal, chapati, anything, these break down into glucose and then our blood sugar rises. To manage that, the body releases a hormone which is known as insulin. You can think of insulin like a key, and this key opens the door of our cells. Now, once the door opens, the glucose from the bloodstream enters the cells and get used as energy. So insulin itself is not bad, it's doing a great job. In fact, it's essential for our survival. Now imagine the situation we are living currently. We are living in a busy and sedentary lifestyle. The frequent snacking, ultra processed food, sugary drinks, bad sleep, lot of stress, and long sitting hours in office. When you do that, the body is exposed to high insulin again and again. Over time, the cells stop responding to the insulin and they become insensitive or less sensitive to the insulin signal. This condition is called as insulin resistance. Let me help you understand insulin resistance with an example. Just imagine you are packing a suitcase for a trip and you put all your clothes there and everything is fitting in nicely. You have closed the you know all the clothes in the suitcase, you have zipped it, and that's all good. Now imagine you keep adding more and more clothes. Soon the suitcase become completely full. But if you add anything else, any other shirt, any other dress, it becomes difficult. Then you have to push harder and harder to close the suitcase. And if you keep forcing more clothes inside, the suitcase eventually may not close. This is exactly similar to what happens in the insulin resistance. Our cells are like suitcase. When you constantly eat, the body has already enough energy stored and the cells are absolutely full. Now, when you have more glucose through additional food, the cells struggle to take it inside. Now, the body responds by producing more and more insulin, trying to push the glucose into the already full cells. And this is what insulin resistance is all about. Now, even if insulin is present, glucose cannot enter the cells efficiently. To compensate for that, the pancreas releases more and more insulin, to keep the blood sugar normal. And for many years, a person may have high insulin, but okay glucose levels, that means normal glucose. And this condition is a very dangerous situation because your blood reports show absolute normal glucose. And it can continue for almost 10 to 15 years. But eventually the pancreas cannot keep up anymore. At that stage, the blood sugar increases in the blood, and that is why somebody is diagnosed with the type 2 diabetes. So in many cases, type 2 diabetes is not a sugar problem, it's a hormonal problem. It's a result of years of insulin resistance developing inside the body. In fact, it's the end stage of insulin, right? Resistance. Now, here is something very important. When the body is exposed to the high insulin for many years, the body also gradually shift from, you know, into a fat storage mode. Now, the energy which is not being used, it gets stored. But the fat doesn't just accumulate under the skin. Okay, a large portion of the fat it can accumulate around the internal organs. Now, this fat is known as visceral fat. Visceral fat it can develop around your abdomen, around the liver, around the internal organs like intestines, like pancreas. And visceral fat is metabolically very active. In fact, it worsens the insulin resistance further. This can lead you to you know, uh, stubborn belly fat, fatty liver, triglycerides, and then metabolic syndrome. Now, the most important point which many people do not realize that You do not have to be overweight to have insulin resistance. In fact, there are many people who are look thin from outside, but they have very high visceral fat inside because they have high organ fat. And this is very common in India. We call it TOFI, thin outside and fat inside. So insulin resistance is just not about body weight. In fact, insulin resistance is all about your metabolic health. Now let's talk about something very, very important what many people ask. When someone has type 2 diabetes, doctors may prescribe insulin injections. Now what happens inside the body? The insulin helps to move the glucose from the blood into the cells. So naturally what happens? The blood sugar levels go down. In fact, if you look at your reports, it looks all good. Your fasting sugar is down, your postprandial sugar is down, because the insulin is very effective in controlling the glucose. But there is another effect which people should understand. The insulin is just not a blood sugar hormone, it is also a storage hormone. Now, when the insulin levels increase, the body receives a signal that it's time to store the energy. Initially, the glucose is stored as glycogen in the liver and the muscles. But once these storage tanks are full, the extra energy that get converted to fat. That's why you can see a lot of people, when they have type 2 diabetes, they start the insulin therapy, they start the insulin injection, and they start gaining the weight. Now, that doesn't mean that the insulin medication is bad. In fact, many times it is life changing because it can save somebody's life. It's necessary for him. But insulin injections do not fix the root cause. The fixed root cause is insulin resistance. The real goal is improving your metabolic health, not just fixing the symptoms. That means you need to address the root cause, address the deeper factors, which can be balancing your insulin, the insulin sensitivity, the visceral fat, liver health, the gut health, the metabolic flexibility. Once we improve all this, the body becomes better at using energy instead of constantly storing as a fat. And that's why you can see people start noticing changes. They have better energy, they have good sugar control, they have better insulin sensitivity and gradual fat loss, right? So if this video made sense, it helped you to understand what is insulin resistance, share with anybody who is struggling with belly fat or like pre-diabetes, type 2 diabetes, and subscribe to the channel, because here, we focus on the root cause metabolic health. We do not work only on symptoms. We do not work only on temporary weight loss. We work on fixing your root cause so that you can get the ultimate body which you deserve. All right. I'll see you in the next video. Thanks a lot for watching this.